Hello, and welcome to this topic concerning prenatal and pregnancy support for incarcerated women. We're going to start with a little bit of history. So, the precise history on the treatment of women in prisons is not documented, but there are factors that have created the system that is used today. As described in the article Shackling and Separation: Motherhood in Prison by Dr. Jennifer Clark and Rachel Simon, the United States population of incarcerated women has increased eightfold since 1970. The rise in incarceration translates to an increase in the incidence of pregnancy behind bars. A disconnect exists between the care that its population should receive and the traditional care in prisons. As described by Clark and Simon, historically, prison health care is a male-focused system and has not readdressed the growing population of incarcerated women. The two main concerns that have arisen from the treatment of these women are shackling practices during labor and delivery and the treatment of the mother and the newborn postpartum. As such, the practice of shackling came from the traditions of male institutions and are not practiced because of valid security concerns. This ethical issue was brought to light after the 1976 Supreme Court case Estelle versus Gamble, which stated that care being provided to inmates must not deliberate indifference to serious medical needs of prisoners, because in doing so it violates the Eighth Amendment. Restraints during labor and delivery can be considered indifference to serious medical needs. Similarly, with the common practice of removing the child from the mother within the first 24 hours postpartum, we see historical issues that have arose from that. One of the main examples was when the Adoption and Safe Families Act was implemented in 1997. This act terminated parental rights to a child who are in foster care for 15 months over a 24-month period. This is an issue because the average prison sentence for a woman is 18 months, which would result in a lifelong separation of mother and child. So what are the national standards? The National Commission on Correctional Health Care, along with the National Congress of Obstetricians and Gynecologists and the American Public Health Association, they compiled a comprehensive list of minimum national standards of care for pregnant and laboring incarcerated women. This list includes, but it's not limited to, standards of care regarding pregnancy counseling and abortion services, mental health screenings, delivery of services in a licensed hospital, prenatal laboratory and diagnostic tests, including HIV testing and prophylaxis when indicated, a sensitive and dignified reproductive system examination as part of an initial health screening, prohibition of shackling during labor and delivery, the standing arrangement for deliveries that allow mother and infant to spend time together after birth, ongoing access to newborns after delivery. So what are the best dates regarding the care of pregnant inmates? Unfortunately, based on the analysis of individual states' legislation regarding the treatment and care of pregnant women, many states do not provide the medical care necessary. According to an article by Grubb, the states that appear to be the most comprehensive in addressing the care of pregnant inmates are California, New Hampshire, New Mexico, and Pennsylvania. This includes prenatal care, care of the woman during labor and delivery, and care of the woman and baby in the postpartum period. What about Colorado? In Colorado, upon confirmation of pregnancy, inmates will be housed at a separate facility in order to receive counseling services and prenatal care. Case management initiates a pregnancy care plan, and the childbirth takes place at a hospital except in cases of emergency. In regard to leg and waist restraints, inmates will not be shackled during labor and delivery of the child, in postpartum recovery while in a medical facility, or in transport to and from a medical facility for childbirth. But there are exceptions, such as serious harm to self or others, or if the woman is a flight risk. Abortion may be obtained outside of the Department of Corrections, though it will not be paid for with public funds. Finally, in postpartum care, physical contact with the newborn may be restricted during hospitalization, as per hospital rules and regulations, and inmates are not permitted to bring their newborn back to the DOC facility. So the challenges faced by people who experience incarceration and pregnancy at the same time includes incarcerated women in general. They experience more life and health challenges than non-incarcerated women. We're going to talk about specific challenges that exist for women with the experiences of incarceration and the pregnancy intersect, and how the overarching challenges of being incarcerated can be exacerbated during pregnancy. Some overarching challenges include increased disease prevalence among incarcerated women, worsened physical, mental, and social health during incarceration, and nutritional challenges. So, for example, when comparing disease prevalence between incarcerated and non-incarcerated women, incarcerated women are more likely to have serious diseases such as hepatitis, HIV, STIs, and other chronic conditions. And pregnancy adds a layer of vulnerability to that. Incarceration can worsen health and social issues that already exist for an inmate as a result of separation from family, specifically children. Being separated from primary social groups can address distress or cause chronic stress, which we know is harmful to a person's health status in general. During a 2012 survey, the majority of the participating prisons reported limited access to fruits and vegetables for women. An increase in calories is needed during pregnancy, and the recommendation is that a large portion of these additional calories are sourced from fruits and vegetables so that the mom and fetus can both benefit from an increase in those vitamins and minerals needed. Proper rest can also be a challenge. In the same survey, a small minority of participating prisons reported allowing pregnant inmates to have an extra mattress pad. Less than half of the participating prisons reported that they allowed for extra rest periods or adjust workload requirements for pregnant inmates. Prenatal care can also be challenging for incarcerated people who are pregnant. They are unable to practice their values and beliefs regarding childbirth in prisons. And for those who report their pregnancies unplanned, they report in absent or late starting prenatal care. Absent or late starting prenatal care can have many negative effects on the fetus and mom, and often causes a missed opportunity to identify a high-risk pregnancy. So what can we do as nurses? In response to the challenges faced by pregnant incarcerated women, we have the ample opportunity to educate and advocate for these women. American Nurse Association Code of Ethics states that the nurses are expected to promote, advocate, and protect the health and safety and the rights of the patients by speaking out and supporting them or defending their rights. And in this prison setting, it means we should be educating them. Correctional nurses, they act as a birth educator and doulas to these women by helping them to fill in any educational gaps around their pregnancies and provide the social support that they may be missing. They can provide education about caring for oneself while having a secondary condition, how that may affect the baby, and what the proper next steps are. Most importantly, correctional nurses can help prepare women to be separated from their child and assess them for postpartum depression after they deliver. Correctional nurses also have a lot to advocate for, such as getting their patients proper nutrition, adequate sleeping arrangements, such as the extra mattress or a lower bunk, a decreased or appropriate work assignment, and more vigorous mental health screenings. Outside of the prison, these nurses can make great strides working with lawmakers to get a more standardized level of care for incarcerated pregnant women and abolish shackling laws in states that still enforce them. And that is all that we have. Thank you so much for watching, and I hope you learned something from it.